Health is a fundamental human right, indispensable for the exercise of many other rights, particularly the right of development. Pharmacists in Nigeria are advocating a more effective government policy towards improved healthcare.
Every day, 3 million pharmacists and pharmaceutical scientists around the world, including Nigeria, act as partners to patients, other healthcare professionals and scientists throughout the supply chain with a shared vision of improving healthcare delivery. This is why the International Pharmaceutical Federation, FIP, says medicines must go hand in hand with pharmacists because this is essential for responsible administration. This year's theme is Pharmacists, your partner in health, which is aimed at improving healthcare delivery and social well-being of the world's populations. From a human rights perspective, access to medicines is intrinsically linked with the principles of equity, non-discrimination, transparency, participation, and accountability. A recent survey shows that out of 120 patients served in a pharmacy per day, 1 out of 6 ask their pharmacist for advice without buying a product, which experts say will go a long way towards improving the use of medicine by patients.
Well, joining me on the news at 10 to further discuss on this is the chairman of the Association of Community Pharmacy of Nigeria, Biola Paul Ozi. She joins us on the news at 10. I want to thank you so much indeed for coming at this time. What is the single most important element on a day like this that you're celebrating World Pharmacy Day?
Yes, thank you very much. On a day like this that we are celebrating World Pharmacists Day, we want to use it to showcase what the pharmacists can do, what we can offer for the society, what we can provide, the kind of professional services we provide to the society at large. Then how people can access the pharmacy, the pharmacist, or the pharmaceutical services.
You are apparently the last line in the chain, the whole pharmaceutical chain from the cultivation to the consumption of it before we get to the people at the grassroots. So you are directly interfacing with those at the grassroots. How important is this concerning the fact that what we have in the country today is a situation where you have people administering drugs by themselves, self-administration? How do you combat that?
Thank you very much. On that note, we are the community pharmacists are actually the last leg in the value chain, the distribution value chain. So we have contact more with the patient, with the clients, with the customers and the final consumers. And the way it is such that many walk into our premises maybe to get over-the-counter drugs, and some also come with prescription to get prescription medicine. But what we have in our environment is that there are so many places where drugs are sold, unregistered places, illegal places, and that makes access to drugs, access to medical products, access to medicinal products so easy in our environment. So people easily misuse and abuse drugs. They easily misuse even over-the-counter drugs. And this inappropriate use of medicine are just in diverse forms. And it's also common even among youth.
So how can you contain that?
There are a lot of things we can do. The government and the regulatory authorities, they have their part, they have their role to play, and as well as those of us that are professionals and practitioners. And that's why the theme of this year's World Pharmacists Day is Pharmacist, your partner in health. At the tail end, the distribution value chain, the community pharmacists, what we do regularly is public enlightenment campaign, and sometimes we also offer some health screening such that people can be aware of the risk factors they have and then begin to take action.
One important thing, though, that you as pharmacists face in Nigeria is the issue of fake and adulterated products coming into Nigeria worth over several billions of dollars every year. How are you able to contend with this inflow and juxtapose that with local capacity production?
Okay, thank you very much. Yes, we have some industries, some pharmaceutical manufacturing industries that are actually doing well presently. But because of our environment, the practice environment has not been conducive, the distribution system had not been coordinated. And because it's not coordinated, it's so easy for people to bring substandard products from other countries and bring them in, such that dumping is encouraged in Nigeria, because we can easily have a flow of such goods into the marketplaces, and then it just go all over the country. All these things have repercussions. They impact adversely on the health outcomes of the people of the country. They make our indices, health indices, to be so low. At the end of the day, we have treatment failure. They are drug resistant. They are to the products, to the drug products. So we have to be looking forward for new molecules, which is not easy to come by with too. So, but what we do, we can do advocacy, we can enlighten the populace, we can talk to the public at grassroots level when they come into our pharmacy.
But are you doing that now?
We are doing that, just like we did during the World Pharmacist Day yesterday, and we've been doing at our zonal levels. From time to time, our members engage the members of the public, maybe in the marketplaces, at motor parks, even in school. We go to schools to hold health alignment campaigns, and this we do from time to time. And whenever we have position paper, we try to forward it to the government bodies, the government parastatals that are responsible for regulation, namely NAFDAC and the Pharmacists Council of Nigeria.
Brilliant. I want to thank you so much indeed, Biola Paul Ozee, for talking to us. Of course, you are the chairman of the Association of Community Pharmacy of Nigeria. Many thanks indeed for your time and your thoughts. Meanwhile, the president has welcomed yesterday's announcement by the World Health Organization that polio is no longer endemic in Nigeria. President Muhammadu Buhari says that he is delighted over the announcement, which follows the absence of any case of the wild polio virus in Nigeria since July 24, 2014. He applauds the concerted efforts of government officials, health workers, volunteer groups, civil society, religious leaders, traditional rulers and international partners, which resulted in this historic achievement. Mr. Buhari, who joined other Nigerians and the global community in celebrating Nigeria's removal from the list of polio endemic countries, urges continued vigilance to ensure that Nigeria maintains this new status. He goes on to direct all government ministries, departments and agencies involved in the polio eradication effort to remain proactively engaged and on guard against the re-emergence of the polio virus in Nigeria. Well, joining me on the news at 10 to further look at this status that Nigeria has assumed as a non-endemic country, being announced by the World Health Organization, the WHO, removing Nigeria from the list of countries where polio is endemic. I'm now being joined on the news at 10 to discuss this further by Mrs. Dr. Adedoyin Ogunyemi. I want to thank you so much indeed for joining us on the news at 10.
Thank you for having me.
What, in your view, should constitute a sustainable culture to maintain this status that Nigeria has attained?
So right now we've achieved the zero status, which means that there is no new case. To achieve this, I think we have to sustain what we've been doing to get onto this. Just to go back a bit, in 2012, we still had about 122 cases. And by the end of that year, we had halved that. And so you'll see that in the last 2 years, a lot of tremendous improvement was done. But this was because there was intensified efforts, for all over, right from the national government to the WHO, Rotary International, and so many organizations came together, and they put in efforts that continued to sustain immunization in underserved areas. So we're able to say, okay, geographically, these are the areas that are most affected. And it was coned down from there to local government areas, and they were able to include mobilization, a lot of social mobilization. So where others, religious leaders and other leaders were involved to participate. So beyond that, even when they had the immunization days, they ensured that it wasn't just sending people out. Technology was involved, looking at the people you send and making sure they're reaching those areas. So a lot of this concerted efforts is what brought us to where we are today. And this must continue.
Let me put you on pause there for a minute or two, as we're being joined by Melissa Corkum. She's the Chief of Polio Communications, UNICEF. I want to thank you so much indeed for joining us on the News at 10. Let's look at the four pillars of polio eradication: routine immunization, supplementary immunization, surveillance, and targeted mop-up campaigns. How do you suppose that this will promote the total eradication of polio in the world?
Thank you very much. As you mentioned, there are four key pillars of polio eradication, and until there's no cases of polio globally, we must continue to ensure good quality campaigns, good quality routine immunization, surveillance, and of course targeted mop-ups in areas where we have lower coverage. So all these strategies will continue, and will continue right here in Nigeria, even though Nigeria is no longer a polio endemic country. While there's a child anywhere with polio, every child is at risk, and all those four pillars need to continue in high threat areas, including Nigeria.
Now tell us, this is the first time that Nigeria has interrupted the spread of polio in the country. What does this mean for the country on the one hand and the sub-region on the second?
Well, it's a historic achievement. For the first time, never to have a case of polio for 1 year, and now being taken off the list of polio endemic countries. So now we're down to 3 countries globally which have yet to interrupt the wild polio virus. So it's a huge achievement to the people of Nigeria, but it's a huge victory for Africa, which now hasn't had a case for over a year. And I think it's an achievement for in getting rid of the second disease only ever globally in history, but it's also a victory for public health because, of course, polio eradication efforts are also contributing to broader public health. So I think it's a huge public health achievement for Nigeria, the sub-region, and for the global polio eradication initiative.
Melissa, let me just put you on hold for a minute or two. As we're also in the studio with Dr. Adedoyin Ogunyemi. She's a member of the Association of Public Health Physicians of Nigeria. She's also here with us in the studio. What are your immediate thoughts concerning Nigeria's successes? Is disappointed that it is a political will that has been able to get Nigeria this far?
Well, beyond political will, which is, very, very key in any activity at all, we have to, go on to active surveillance, and whatever efforts have been put in so far, that whatever teams and groups, presidential task force have to continue, despite the fact that we've been delisted from the list of endemic countries, because we've not been free until 2017, if we're able to achieve this up until 2017. So these things have to put in place, not just active surveillance, but notification. We must be able to scrutinize, look for. And I want to also say that we have a lot of internally displaced persons now, and we mustn't forget the camps. So it's not enough to do the door-to-door. We have to go into the camps. People are moving.
Also do that
People
Okay.
are moving from place to place, and we must check this as well.
Interesting. Melissa, what role do you see donor organizations, for example, development partners, taking this sustainability drive towards, especially in other countries that still have the prevalence and endemic nature of polio, talking about Afghanistan and Pakistan?
Yeah, now, Nigeria has been taken off the list of endemic countries. We have 2 countries left with endemic transmission. But at the same time, efforts will continue. Here in Nigeria, as the doctor mentioned, we will continue through to 2017, an aggressive schedule of campaigns, and even more importantly, focusing on routine immunization to protect the gains. And there'll be a big focus on, scaling up efforts in Pakistan and Afghanistan, and they too have recorded a success this year. Of those 2 countries, last year this time we recorded 359 cases. This year we're down to 41 cases. So a lot of efforts are being put into scaling up, building on the successes of some of the work that's taken place right here in Nigeria. But let me assure you that the efforts still even need to continue here in Nigeria to immunize children during supplementary campaigns, to improve surveillance, and to improve routine, and also to focus on maternal and child health.
Interesting indeed. Melissa Corcoran, I want to thank you so much indeed for your time and your thoughts. She is indeed the Chief of Polio Communications of UNICEF, as well as Dr. Adedoyin Ogunyemi, Member Association of Public Health Physicians of Nigeria. Thank you so much indeed for your time and your thoughts. And next on the news at 10, Barcelona forward Lionel Messi is ruled out for up to 8 weeks following a knee injury. We have that story in sports. After now, stay with us.